back, a naturopath. We're back to you again. We're talking about autoimmune disease. So I trust you've watched the previous videos where I spoke about what is autoimmunity, who gets it, things like that. So now we're going to talk about the 14 common types of autoimmune diseases. Actually 15, there's probably 20, but I've shaped it down to about 15 types. So I'll just mention the autoimmune disease. I'll talk briefly about that one so you sort of get to know a little bit about it. So the first one we'll talk about is type 1 diabetes, or diabetes insipidus. So diabetes mellitus, or type 2, is different. Type 1 is autoimmune, type 2 is not autoimmune. It's more adult onset, or it's usually lifestyle generated. So when you've got type 1 diabetes, you've got an insufficiency of insulin production. So the Addisons cells that produce insulin in the pancreas apparently have a problem. They don't really make enough insulin anymore. They're getting attacked by the immune system, and that creates a whole bunch of problems. Often people pick up type 1 diabetes quite young in age, but I have seen this condition also come about through various drugs or medications, and even severe emotional shock can push somebody into type 1 diabetes. So a good friend of mine, in fact, has 2 kids, well, they're grown up now, with type 1, and it can happen. I mean, it can just happen. It can happen in families, and sometimes it's idiopathic, and that means no known cause. Really strange how it can happen. So in type 1 diabetes, the immune system attacks and destroys the insulin producing cells. High blood sugar results in can lead to damage, of course, of blood vessels, eyes, kidneys, things like that, and nerves. You can get all sorts of damage occurring. So the person has to monitor their insulin levels and take regular tiny little jabs of insulin, often once or twice per day, to keep the condition under control. The second one I've seen so much of is rheumatoid arthritis. So this is the inflammatory arthritis. Okay, this is not the wear and tear osteoarthritis, which often occurs of old age. But I don't believe osteoarthritis or any form of arthritis should occur in anybody. If you read old books like I have in days gone by, many times, for example, a graveyard would have to be removed because a road was coming through. So studies were done on bones of people that lived in the 1800s, 1900s, and many studies have found people not to suffer from degenerative conditions like osteoarthritis or rheumatoid in many different places of the UK and the US. And these are people just eating good food, basically, not really getting the deficiencies we're getting today. So rheumatoid arthritis often affects the hands, the small joints of the fingers, and it can be extremely painful. So yeah, this one really is bad for some people. I've seen some people have terrible quality of life with rheumatoid arthritis. One of my key things I like to do with these kind of patients is to do a comprehensive stool test and check for streptococci bacteria, Klebsiella bacteria, and other kinds of dysbiotic flora. And we work on it. In fact, that's the thing I'm going to talk about later, a part of treatment, which I recommend for all autoimmune patients, is stool testing. Because bacterial infections are one of the key drivers behind inflammation. So even my old textbook here, 1936, rheumatoid and climacteric arthritis, which, well, basically menopausal arthritis you're talking about. But yeah, we'll talk about this book later. But it's interesting, in the book it says in all cases look for the hidden infection. And in fact, in all autoimmune diseases, I recommend you do that. So rheumatoid arthritis patients often go on strong medications to reduce the pain. But there are lots of alternatives, of course. There's psoriasis, of course, and psoriatic arthritis. So psoriasis affects quite a few people. So this, as I mentioned previously in another video, is the hyperproliferation of skin cells. So the skin's being attacked, and the skin cells are being shed at a very quick rate, which causes flaking and irritation and itching and scaling, and sometimes even bleeding. So up to 30% of people with psoriasis, I think it's something like 24%, in fact go on to develop PSA, or psoriatic arthritis, which is a very painful condition of inflamed joints and a skin problem. So the other thing that you'll need to learn with autoimmune conditions is if you have one condition, you can develop a secondary condition as well, unfortunately. So the fourth condition is MS, or multiple sclerosis. Now in this case, the myelin sheath, or the insulation around the nerves, is being attacked by the immune system. And this can create all kinds of sensations like, peripheral neuropathy, like burning feet, tingling, numbness, pain, tiredness. Mood disorders often come with it. There are different types of MS. You have the some conditions where it will go quite fast. Others it's remitting and relapsing, so it will stop, start, stop, start. So you'll find that with many autoimmune conditions. Some will go in a steady, slow progression. Others will, they'll go a little bit, then they'll stop, and they'll go a bit, then they'll stop. So according to a 2012 study, about 50% of MS patients need help walking within 15 years of the disease, starting out. So it can affect your feet quite badly, that one. Multiple sclerosis is a condition of the temperate zones. We see it predominantly in the north, right up north, and also down south. So Scotland, regions of Canada, and also, of course, New Zealand have very high rates of MS, which makes many researchers believe there could be a vitamin D problem or a sunshine problem there. So SLE, systemic lupus erythematosus, SLE, first described, I think, in the 1800s. Lupus, after Lupus the wolf, because there's a rash that people can get on their face. It's sort of a wolf-like rash, and that's where the word lupus comes from. So lupus can affect women pretty bad. I've seen some quite nasty cases of lupus over the years. In fact, the worst cases I've seen are the people who had the worst digestive systems, which is quite interesting, which made me wonder whether it was the medications that wrecked their gut or if the condition, brought on the lupus. I mean, it's hard to know in some cases. So with lupus, as I mentioned previously, this is a systemic condition. So lungs can get affected, joints, the heart, eyes, kidneys, many different parts of the body can be affected. There are also various pharmaceutical drugs that drive these conditions. So that part of the cause of many of these autoimmune diseases can be iatrogenic or drug-induced, which is devastating. Inflammatory bowel disease, IBD, is something I've seen an incredible amount of in New Zealand since I started practice. I saw many patients in Australia with inflammatory bowel disease, particularly ulcerative colitis. In fact, most of the young people I've seen in New Zealand were taking a drug called Roaccutane or isotretinoin for their acne. And there are known links between that drug and inflammatory bowel disease. I've seen at least 7 cases of the last count of young people who developed inflammatory bowel disease after taking this particular drug. So be careful if you've got acne not to go on Roaccutane or isotretinoin. It could also be called Accutane. It's a devastating drug. Go to Google and Google Accutane or acne treatment and inflammatory bowel disease. You'll find tons of stuff there. The doctors all know about it. So there are 2 types of IBD, inflammatory bowel disease. The more insidious one, or the very disturbing one, is Crohn's disease, which can create deep ulcers anywhere in the mouth all the way through to the anus. Whereas ulcerative colitis, as the name implies, it affects the colon more, the large intestine. In both of these cases, it's very, very important that you get a comprehensive stool analysis completed to see what needs cleaning up in the gut. I've worked with hundreds of cases of IBD, and the success rate on reducing symptoms to a minimum is very, very high when you work a natural program. Addison's disease, number 7. This is an adrenal insufficiency. So people with Addisons are often born like that, but again, it can be developed iatrogenic through a drug or a shock. A big shock. I've seen some people develop Addisons after the Christchurch earthquake that we had here in New Zealand in 2011. Seriously bad earthquake. I think we had 230 people pass away, and I saw 2 cases of Addison's disease that developed around that earthquake. Addison's disease affects the adrenal glands, which produce hormone cortisol and aldosterone, as well as other androgen hormones. Having too little cortisol affects the way the body uses and stores carbs. But having too much is devastating also for the circulatory system, which occurs with high stress. Deficiencies of aldosterone can lead to sodium loss, excess potassium in bloodstream, weakness, fatigue. You get all these kind of problems. And a precursor to Addison's disease often is adrenal fatigue. So some patients I've seen have had seriously poor adrenal function and then just plunged into Addison's disease. Graves' disease. Overactive thyroid. So Graves' disease basically is when the thyroid stimulating hormone drops down too low. because the thyroid got kicked in the butt too many times by the pituitary gland. So the thyroid works overtime. The eyes can get affected. There can be a lot of photophobia, you know, like the sunlight's affecting the eyes quite a lot. Anxiety, tremor, palpitations. These are quite common with Graves' disease. Restlessness, can't sleep properly. Weight loss, high appetite but can't gain weight. So again, there are various medications that doctors will peddle for Graves' disease. Carbamazole is a drug of choice often used for this condition. And I'm not averse to carbamazole because it works quite well, and once patients have learned to slow down, often they can be slowly pulled back on the medication. What have we got here? Actually, we should chuck another one in there. I know, actually. Hashimoto's is already in there. Hashimoto's thyroiditis. So Hashimoto's is not uncommon. It's in fact the most common thyroid disorder globally is Hashimoto's. So Hashimoto's can affect your thyroid, often make it go too fast or too slow. Many patients who develop Hashimoto's will initially go through a hyperphase, and that can last anywhere from a couple of weeks up to a few months. The hyperphase will slow down and they go and plunge into a hypophase. So there'll be shades of overactive and underactive, you know, every now and then in the patient who's got Hashimoto's thyroiditis. So as the thyroid starts going down in function, the body becomes colder, there'll be more constipation, there'll be huge fatigue and sleeping disturbances, all kinds of issues there. Hashimoto's, again, still testing needs to be completed. Comprehensive hormone panel needs to be completed. Hormones need balancing. Also worth, in cases of many of these autoimmune diseases, to do a hair analysis to see if there's any toxic metal junk in the body. Okay, it's not uncommon to find a lot of lead or mercury or arsenic or cadmium in these people. Remember, we spoke before about the environmental concerns about toxins and fertilizers and printing ink and, you know, solvents and junk like that. So the more you expose yourself to chemicals, the higher the probability you're going to get a sickness. So the next one is Shogun syndrome, which is a little bit like can be classed as a connective tissue sort of a disease, a little bit like lupus. Shogun's affects the eyes quite a lot. In fact, my mother-in-law has Shogun's currently. But my mother-in-law's naughty because she also likes to eat lots of white bread with jam. That was her breakfast for many mornings. So when you're eating lots of sugar, of course, bacteria love that. So you can push yourself into a bad bacterial state, which can drive up autoimmune disease. So Sjogren's affects the eyes, dry eyes and dry mouth, and also joint pain. But the dryness of the eyes is a hallmark, is a red flag for this condition. Myasthenia gravis. So this is a really nasty condition that affects the nervous system. It affects the nerve impulses that help the brain control the muscles. So as soon as there's an impairment there between the brain and the muscles, you're going to get all kinds of problems, all right? You're going to have problems with swallowing, with talking, with walking, with movement, with all sorts of things. So the muscles that control the eye movements, eyelid opening and swallowing, and facial muscles are often involved. It's not a nice condition, myasthenia. Then there's autoimmune vasculitis. So this is a blood vessel condition. So the blood vessels can get attacked. The inflammation that results narrows the arteries and veins, allowing less blood to flow through them. You get a condition called ischemia, and that can lead to, you know, all sorts of problems with hands and feet and different parts of your body. Pernicious anemia is the next one. So that's a problem with vitamin B12. So usually it follows your stomach, and these cells that produce this stuff called IF, or intrinsic factor. Now, intrinsic factor is a hormone, protein hormone, that binds to B12, that takes it down to the terminal part of the small bowel for uptake. So if you've got a problem with intrinsic factor, you can't really have a good source of B12 in your body, and that leads to neuropathy. You know, that leads to depression, tremors, again, tongue problems, that people get swollen tongue, sore tongue. Depression can range from mild to serious bad clinical depression. What else have we got with pernicious anemia? We've got sleeping disturbances. We will have, again, burning feet with some people, tingling, they'll have poor grip strength. There'll be many different things going on there with pernicious anemia. So that affects people aged over 60 more than anything. Celiac disease is the next one. So celiac, of course, is a problem with gluten. So this is when you build antibodies against gluten. So it's only a small percentage of people. I think it's about 1% of people with celiacs. So many people believe that they can't tolerate gluten, in fact dump gluten when they're non-celiac. Most people can tolerate gluten to a degree, but it depends how much you eat, right? A study noted that celiac affects 1% of people. A large number of people have reported gluten sensitivity, which is not autoimmune disease, but have similar symptoms. So you can have issues with gluten, but not be celiac. Okay, that's another thing that you've got to think about. So these are just a few of, I could spend an hour talking about so many different types of autoimmune diseases, but these are the common ones. You may have a condition now that's not amongst these 14, 15 odd diseases, but don't worry, you can look it up on the internet and get an idea more of the condition. Stay tuned, because we're going to talk more about autoimmunity in the next video. What are we going to do now? We're going to talk about causes in the next video. Catch you in the next one. Thank you for tuning in.